Hi Tom, hi Anne-Marie. As you know, I'm Sue Green, one of the instructors for our Trauma and Human Rights course at the UB School of Social Work. I'd like to ask, if you would, to let the audience know who it is that you are, what your role is now in your current job. And I will just be asking you questions, and I'm hoping to have a real dialogue over the next hour or so regarding the issue of trauma-informed care. So Tom Nochajski, Dr. Tom Nochajski, if you wouldn't mind.
Okay, sure, I can introduce myself. I'm Tom Nochajski. I'm a faculty person here at the School of Social Work at the University of Buffalo, and I also am the co-director, along with Sue, of the Institute on Trauma and Trauma-Informed Care. So we've been doing a lot of work in those areas. Sue's been pushing me to do more and more here. I don't know.
Thank you. And Anne-Marie?
Yes, Anne-Marie Orlowski, although I'm also known as Anne-Marie Dershberger through the School of Social Work, or I am also a faculty and adjunct faculty. As well, I work at Gateway Longview as the Vice President of Community Services.
So I know that both of you actually have heard of trauma-informed care before, and really the intention that I have for this interview is to give students an opportunity that are taking this course to hear from the two of you, and certainly I'll have a couple of things to say about your experience of a couple of things. Certainly not to age all of us, but each one of us sitting here right now have been around the human service arena several years in different roles and different capacities. And each one of us sitting here has also become new students, if you will, and teachers of Maxine Harris and Roger Fallett's instruction around what we call trauma-informed care. And our students are being asked to look at their current internships or organizations, agencies that they work in as an intern or have worked in even in the capacity as a helper. And we're asking them in an assignment to really deliberately take a look at the issue of trauma-informed care in that organization and what's going on, you know, what's happening in this system or in this organization. So I want students to hear from us our experience and our knowledge base at this point in time around this topic. So Tom, I actually want to start with you because as you stated, you and I do trainings actually from the Institute, and your expertise, I would say at this point, in regards to looking at this issue of trauma-informed care is to really focus in on the organization and how trauma-informed care possibly could be thought about regarding the research on organizations, etc. Can you talk about that?
Yeah, sure. And in fact, when you look at Sandra Bloom's sanctuary model, or you look at the Fallett and Harris, or Harris and Fallett, whichever way you want to say it, their model, in both cases, what they are talking about is really an organizational change process. It's not about just focusing on the clients. It's about having the organization change its whole climate and culture to become more sensitive to trauma and be trauma-informed, not just for clients, but also for their employees, their staff, everybody who works within their organization, to take a trauma-informed approach with them as well, so that the whole culture shifts. Now, within the context of Fallett and Harris, we use their 5 dimensions of safety, trustworthiness, choice, collaboration, and empowerment when we go out to organizations to see how staff are viewing those types of issues within their organization, how the agency is treating them with respect to all of those elements. So what we try to do is get some idea about where the organization fits within that model. Are they, in fact, providing for emotional and physical safety for their staff? Do they think about those things, or is it really more focused on the client? Same thing with trust. Are they building trust with their employees? Are they building trust with the staff to make sure that, okay, yeah, the staff come in, they know that if something happens, they can rely on people to be there and do things, instead of wondering, well, if something happens, who's going to help me? What's going to go on? So things like that are very important from a trust standpoint. Same thing with choice now. do the individuals have choice? Does the agency allow for that, or are they very restrictive, unflexible? That can have an impact as well. Same thing with collaboration. Do they work as teams? Do they work with each other? And then finally, the empowerment process, allowing staff to grow. Does the organization really consider that from a trauma-informed perspective? That would be great. Now, again, so you know this very well, that we've been out in the community doing a lot of these surveys, and in fact we've done focus groups as well with agencies around trauma-informed care and where they are with that process. What we found in the reaccreditation survey first was that most organizations, when you talk about trauma-informed care, that's what they think of is with the clients. They do not consider the staff. And even more importantly, when they think about staff, it's never all staff, it's just the line staff that they consider. Support staff never, they're the ones that seem to be left out of everything in terms of anything they're going to do with training around trauma-informed care. Those folks don't see it. Anything they're going to do with training or advancement, those folks don't tend to see it. That's an issue, and that's something that within the context of what trauma-informed care really is, if you read, Sandra Bloom's model, you read Fallon Harris, it's really about everybody in the organization getting this process and being taken care of. That's kind of where we go out in the community and try to do this. And we've done it with a number of agencies, as I said. And again, it's really consistent. And almost every agency we look at, you find that the support staffs are just not being considered in this process. And when you look at it and you start thinking about this, especially from the context of, say, residential settings or any place like that, I mean, when you talk about, your support staff, they may actually have more contact with the clients than the direct line staff do. And yet they're not being trained in trauma-informed care. So what's that do for you as an organization? So again, the other day we had a conversation about this, and one of the questions was raised, well, what's in it for the organization? Why should we do this? And I said, okay, well, think about that. If you are trauma-informed with your staff, again, with staff, this is what it can do for you. A major benefit would be retention. That means you don't spend as much on training, on hiring, trying to keep staff there. So that's major. Less absenteeism. And again, if you're doing trauma-informed care with the staff and with the clients, you're going to have less potential incidents in terms of lawsuits, etc., stuff like that. So again, it benefits the organizations to do this. The issue is how to go about it. And again, I could probably talk for a lot longer, but I probably should let you go on.
Well, I have several thoughts that come to mind as you say this, and certainly, Anne-Marie, I'm going to ask you to make comment, too, around what Tom has stated, but I have a question as a follow-up to that. I believe that there certainly is some beginning research from Sandra Bloom's model, from the sanctuary model, where the three things that you were just talking about, retention, incidents, if you will, in terms of things going on within the organization, or even client response. Maybe you didn't say that directly, but client response to the staff, and then looking at cost around training and different things. Can you just say a little bit more about that? Because I'm thinking of one of the examples you often talk about in terms of correctional facilities, prison, like we have the beginning evidence of this.
Yeah, we do. And again, if you go back to even when our school had the training from NCTSN, they did that video, and they talked about the fact that one of the first places they tried this was actually in a women's prison.
Yep. And
again, when you think about it, enforcement is one of the places you wouldn't even think of trauma-informed care as being part of that. But they actually trained the folks, and they actually tried to do that. And what they told us was that the staff, once they started actually doing this, they started to see less incidents with the inmates. There was less violence, less potentially restraint use, and having to go into a cell to calm somebody down. That all decreased. And again, that's really important, because that's cost savings for the organization to think about it. Less likely to get injured on a job, potentially, because you're a happy employee, you're working, things are working for you in a trauma-informed setting. So I think that's important. Retention is also, think about this. If you've got, you know, and I don't want to make light of this, but if you've got an organization where you're happy as a pig in shit, oops. Okay, sorry, you can edit that out, but okay, if you're happy and you know, things are going well for you, you're being productive, etc., the organization is responding, showing you that they appreciate what you're doing, you're way less likely to be leaving that organization than if you go into an organization where you can't trust to say, if you say something to somebody, you're going to be hearing it from another person. I mean, again, if there's no trust there, there's no feeling of emotional safety, why would you stay? Again, so I think that retention process is part of the culture that trauma-informed tries to build, so that it's a culture where you want to stay, it's a climate where you want to stay. And if people stay, then that means you're not going to be spending that much money on trying to recruit people in and retaining people. So, you know, I mean, that's a major benefit. And also that'll cut down on absenteeism, because if a person's not happy, they're more likely to call in sick, stay away.
So, Anne-Marie, I'm aware that your agency actually has adopted the idea of trauma-informed care deliberately over the last, what, 2+ years, yes, in regards to lots of staff being trained, and lots of commitment specifically on your part, leading a bit of the effort, if you will, in regards to your entire organization. You have a large organization, numbers-wise. You sit in a senior position. Can you talk about, you know, just your experience and, yeah, what is the number? And
yeah, it's been very exciting. About 2 years ago, I partnered up with another colleague of mine, and we were very aware of the concepts of trauma-informed care, but weren't really quite sure what it meant to our organization. We're not new in dealing with traumatized children and families, and the concept of trauma has been around for many decades and years, since the organization has been around 100 or so years. But the reality was, what we were hearing from our staff was there's no common language. We're doing our own thing, you know, in our own departments, and really they were seeking out an opportunity to be able to collaborate and to work together, to be able to have common understandings. What are you doing in working with traumatized children? What are we doing, and what can we do together, not only for the sake and to be able to enhance outcomes for children and families, but also for staff? Because as Tom said, the nature of having staff who are vested, who are you know, enjoying the work that they do, who have a passion for that work, that can quickly go to the wayside if they're burned out, if they're tired, if they're not feeling recognized. And by virtue of us pulling staff together, how we started our initiative was we asked folks to attend a focus group just within our own community services department, and asked for their feedback and said, what does trauma mean to you as an employee? What does it mean for a client? What does it mean for the folks that we serve? And we looked at that, and then we did some scaling, and we did some you know, further questions, asking them to please rate what did they think our agency, how are we performing as an agency in responding to their needs as employees surrounding safety? You know, how much choice did they feel they have in their work environment and in the role that they had, whatever role that they served within the organization. So we took that focus group as a starting point and solicited a lot of energy and attention that staff were now being able to talk about their needs. Not that they hadn't been able to before, but it was in the context of, you know what, let's work together to collaborate. And it took off very quickly and very positively. We then started looking at establishing, collaborating with folks in the community, with the School of Social Work and the faculty who have provided trainings for us, partnering with our overseeing accrediting body, the Office of Children and Family Services, to be able to really look at and establish what our best hopes were for our organization and for our clientele, ultimately, those we're servicing. And then started developing a strategic plan and a plan of action to say, okay, how are we going to take this great initiative and how are we going to start infusing it within such a large organization? And we needed to, we were sure to look at the fact that this is very large, and it was it's a daunting task to look at such a large organization, and we really decided we needed to do it in a kind of a multi-tiered approach and phase it in versus trying to take a concept and one day we say we're trauma-informed when yesterday we weren't.
Right.
So we were very conscientious to make sure it wasn't the next buzzword that was going to come in and out of the organization or the profession in a matter of weeks and then say we've been there and done that.
So I've witnessed that with your organization, and I want to amplify a little bit here because of what this next point. Fallett and Harris, in their directive, if you will, in their book, talk about in creating an organization that becomes trauma-informed, they give us steps of how to think about this and how to be strategic. And they really talk about how important it is to have buy-in from the top. And so can you speak to that a bit? Because I also know that you have knowledge of another very large organization that they too have taken a very deliberate approach to becoming more trauma-informed. And for each organization, there are certainly your own issues and or considerations that come into account in terms of when you make decisions of what to do next. Mm-hmm. So can you just speak to that idea a bit? Because you also said, the Office of Child and Family Services, which is obviously even higher up, they give the money, if you will, right to support the type of care that, so can you talk about that process a little bit?
Yeah, well, being in an administrative role myself,
okay.
I think was an advantage in this situation in that I strategically partnered with another employee who actually was a line staff per se in our department, who was very interested in being a part of it, and it was a really nice, I think, collaborative relationship because I was able to work on our administrative end of being able to work with our management team, work with our administrative leadership team for the organization, as well as any other kind of collaborative partners, while Kara, who is my counterpart, was working with staff, and she was kind of the liaison to the line staff and to her colleagues in being able to start the initiative and create a lot of energy surrounding it, being able to capture people's interests, and people were jumping on board. Oh, what is this? And I want to be a part of this, and oh, maybe I'll consider being a mentor. So it really was strategic and I think very advantageous because we were able to simultaneously work on being able to advance the initiative both up as well as down the organizational hierarchy and structure.
So I want to,
let me
please,
just say something. That's really, really important. I mean, the points you've been raising are really critical. The idea that it's a developmental process, absolutely. The other thing you just started talking about when you mentioned it, Sue, was buy-in from the top, but it's also, is the organization ready to do this? And if they're not, how do we go about doing that? And what you were describing, I think, is how you were attacking that problem. Okay, are we ready? What do we need to do to get ready, and how do we go about doing it?
Yes.
So I think that's really nice.
And establishing partners in that. So another administrator on the administrative team oversees all of our residential programs. So we were working very close in partnership to say, how can we had to prioritize and start somewhere. What can we do to prioritize rolling this out? And we specifically focused on our clinical staff and our supervisory staff to engage them, to be able to solicit their buy-in, and it targeted our first training group surrounding those folks. And then transitioned to establishing mentors who were
in-house
cheerleaders.
mentors, right?
Yes,
Okay.
in-house
Mhm.
mentors in those groups of staff who had gone through the training. And those folks who really stood out as being energetic with the model, as utilizing the model, embracing it, and being cheerleaders, so to speak, for the advocates for the model. And they then, without necessarily our nudging them or any kind of requirement, they took that and they started incorporating their own activities and coming up with activities and incentives to the group to do during our staff meetings. Postage of signs throughout the walls that encourage the principles of trauma-informed care, and things to be able to immerse staff in not only seeing it but hearing it, talking about it, and really trying to connect the points together.
I also would like you to, if you wouldn't mind making comment on, I'm aware that your supervisors also have made comment around using this in their own coaching, if you will, with their staff.
Absolutely.
That even when doing supervision with, let's just call it the night staff that run the morning routine for the kids, there was a classic story that one told in terms of how to interface with that staff that were running that shift, and what the difference was of how when this person started taking into account the option of choice and the idea of empowerment. Do you remember that story at all?
Yeah, well, there have been many stories about the nature of more qualitative interactions with both staff and youth and clientele as a result of using a trauma-informed approach and tying in the solution-focused model as well. But particularly in our residential program, when we looked at really focusing on the principles, giving more choice, being able to collaborating with rather than doing for and doing to, you see a lot more synergy, a lot more participation, willing participation and engagement with youth and the workers. Even, I think it also takes an incredible burden off of staff and employees' shoulders, feeling like they're the ones responsible for solving problems of the youth that they're caring for or who's under their supervision. So
believing that people really are their own experts of their own lives.
Absolutely, and that they, by mindful use of their language, mindful actions on their part, realizing that. And wondering, and being a part of understanding what has happened to these clients and these youth to bring them to this point versus, what is wrong with them and the problem-focused mentality.
And thus the mantra of trauma-informed care, right?
Yes. Mm-hmm.
Because as I'm listening to both of you, sometimes we've had discussions amongst colleagues where it's like, well, this is just good social work practice. So what is it about trauma, right? What makes this be about trauma-informed care? And so I'm gonna go there a little deep here for a second, and it's certainly depending on your willingness. Okay.
Sure. Mm-hmm.
Emery, one of the things that you've been wonderful about in terms of with our own students, in terms of those that might be viewing this tape, is that you've been willing to make a statement out loud about, you know what? I too have a history,
right.
And I've had experience in terms of taking notice of how systems of care or organizations are with people. Would you mind speaking to that a bit around how you see this whole topic plays into your life or what it was like? Or
Yeah. Well, I guess I'll preface it by saying that in addition to my professional experience working in child welfare, I also come from the perspective of having experience of being a child who was placed in foster care locally here locally in the county. And I was placed when I was around 6 or 7 years old, and then eventually adopted by my foster parents at the age of 14. And the system back back then was very different as it is today. And there was far less opportunity for training and for coaching of foster parents. Staff training was not nearly as thorough or mindful as it is today. And the nature of the permanency planning and the treatment planning for children in care was very different than it was today. But in addition to those experiences of having been a child in the system for that long and then working in the system, I had an opportunity and a situation, a crisis that occurred in our family's life where my husband and I were suddenly becoming foster parents for my niece and nephew, their family was in significant crisis, and they were 13 and 16, and they were in a position to potentially be placed in foster care. So it really helped to connect some of the dots for me, I think, as far as in not only having worked in the profession and having experienced it myself, but being in the role of a foster parent. And it was rather alarming to me in some respect, because as a career professional working in foster care, I was shocked to see some of the information that was being provided to me by other folks in the profession that was not accurate, sending me to places for appointments that were the wrong office, and sending me to fill out paperwork that really wasn't needed. And it was just a wide, I guess, an eye-opening experience. And I think about the fact that I am somebody who is more familiar with this system, but then I think about our clients. And if this is happening to me, what's happening to our clients and to our folks who really don't know much about how to navigate this very complex child welfare world, and where all of the challenges that they face in addition to whatever their current crisis is. So I think when we're talking about those principles, those 5 key principles of safety, trustworthiness, collaboration, choice, and empowerment, that really when we look at our own experiences and how we're working with families, I always encourage people to remember that we are one step away from potentially being in the shoes of clients, and remembering that. So when we're working with them, we're doing that in a way that is genuine, that's respectful, that is enhancing their ability to trust us, not only as a staff person, but as a member of an overarching context of practice, as the social work field or the helping field.
Tom, yeah, please, because I'm thinking of you as Emery's speaking, that there's, please, and I'll ask if you don't say it.
Well, again, what I'm thinking of, this raises 2 things for me. First is, it relates the critical nature of why organizations should be trauma-informed care with their staff. Many of them have a history. And the idea is to ignore that seems to me to be ludicrous if you want to be trauma-informed. How can you ignore the fact that some of your staff have had that experience and not understand that process and what it may do to them as they relate to clients, how that may trigger problems for them that the agency should be aware of and should have things in place to help with that process. So again, I think that for me just underscores the importance of making sure that it's an organizational process and it's not just focused on clients. Because staff, especially in the human services, so many have gone through issues themselves that, if there's not protection there for them, how are they going to make the clients feel safe and trusting? I just again, for me, it's pretty straightforward, and you just underscore that.
Sure, and some of those ways to be able to support the staff are by offering an employee assistance program that staff can access, voluntarily, offering health and wellness opportunities, and and recognition of employee satisfaction and morale and team building and
Yep.
having them be a part of organizational decision making where it's feasible.
Yeah,
You know,
and it can even be somewhat, I mean, I'm thinking about one of the organizations we've done some stuff with, and again, one of the comments from the residential staff were, they never ask us how we are after we have a takedown, after we got to put a person in restraints. They always focus on, how's the client doing, you know, what happened here? It's never, how are you doing?
Right.
You know,
Right.
so again, I think something that's that simple can have a huge impact.
So you're not even talking major money stuff. It's
No.
really a shift of, you know, so of taking notice. So trauma-informed, bottom line is believing that, you know what, trauma may be a piece of the story for many of the people, clients and staff that are in this organization. And it doesn't mean necessarily that we are in a position at all to have to fix any of it, but we are considering the fact that the story is there. And so when we're interfacing with our colleagues or with that other worker from a different agency, when that person possibly gets under our skin for a moment, to be able to ask the question, all right, so what's going on with this person or with me versus what is wrong here, and moving quickly to a labeling and blaming stage. Very, very interesting.
Yeah,
You know, go ahead.
I think even recognizing, you know, the reality that the families who come to our doorstep or who come to be referred to our organizations, that they typically have had the same aspirations for their children, and being successful children, going to college, being whatever their childhood dream was to be in the future, and looking at what is it that became obstacles for them that got in the way of accomplishing those hopes for that family. Because looking at the surface of the family's dynamics typically is what is focusing on the problem, but being able to kind of peel back those layers and look at what is truly that family has experienced and has gone through, typically is the you know, helps to be able to inform your understanding as to what's going on for them now, and recognizing that child who comes to us at the age of 13, that parent and that family managed to keep that unit together for 13 years under some very dire and typically challenging circumstances, and recognizing those strengths.
So I'm going to wrap up because I think that we could probably talk for a very, very long time. Are there some take-homes or some kind of recommendations that either of you have in regards to, again, think about somebody who's first learning this right now, and each student is probably in a position that their task for an assignment is that they need to look at their current organization or some organization in a system, looking at both staff and clients, taking trauma-informed approach, being considerate to that. Specifically also then the human rights perspective, which I haven't asked you to talk about. Any thoughts, recommendations that you have for our students right now?
There's one that I try to get my folks in research to understand, and that is, whenever you've got someone sitting in front of you, you need to be aware of where you are. You need to be aware of how anything that's happened to you may influence your interaction with that individual. You also need to consider what's gone on with the individual, like what's their life stuff they're bringing with them that may influence how they're behaving in front of you or reacting to what you're doing. So again, awareness is key, and I think that's true for research, and it's certainly important, but it's also true if you're just going to do something with a client that is even easy. I mean, not easy, I don't know how to say this, but like where it doesn't seem like it may matter, it does. And again, I think you always need to be aware.
I'm smiling because I'm thinking about Tom and I have known each other for a lot of years. And as we decided to become co-directors of the Trauma Institute, it's been a very different dialogue that you and I have had over the last year as a result of needing to be paying attention deliberately to our work. And so, based on what you even just said about being present to your client, that's been true of what we've needed to do with one another in terms of colleagues.
I agree.
And it has changed the nature of us being able to effectively work with one another, I think.
Well, again, I would say you're right. I think in any situation, if that's the case, being aware is key. So that's my take.
Yeah, okay.
Also, one other one, just,
Please.
I'm sorry.
No, please.
But just one other one, and that is that when you start thinking of implementation of trauma-informed care, it is a developmental process, and it does take time. It's not going to happen overnight, especially if the organization's not ready. If they're not ready for any kind of a movement, or if there's going to be some opposition, it's going to take time, and it is an effort.
I would echo what Tom has said in regards to the importance of maintaining our own, I guess, worldview and our own perspective as we come into this work, and also realizing that that perspective can change as our own life circumstances change. So my perspective as a child in the system versus as a professional versus as a foster parent just years ago has been impacted each time by whatever the circumstances are, and realizing that it is fluid and that it is subject to change, and maintaining what kind of self-care we need to tend to for ourselves so that we can continue to stay in this profession and to avoid burnout, to avoid sarcasm, and to be able to continue to be there for our families. Sometimes the best thing we can do is take a vacation to be able to re-energize ourselves and to get back to what our role is. On top of that, I would say that the process is ongoing, and the skill building is ongoing in being able to, and sometimes it does not come easy, to be able to reframe how we see ourselves, and shifting some of that expert role from historically us as social workers or as the people who were solving problems, but to the families, to the youth, to be able to teach us about themselves and allow them that expertise and control to be able to make those decisions and trust us as folks who can potentially be agents of change.
Maybe I'm glad you mentioned self-care.
Yeah, for sure. Yeah.
That's good.
Thank you so much.
Thank you.
To be continued, I'm sure. Thanks.
Thank you.